Hey guys, welcome to a new episode of No Mama Grow Mama. This is the place where we talk about all things related to health, wellness, well-being for you and your entire family. That encompasses so many different topics, as you have probably seen from our series already. So we are back again with Dr. Ana. If this is the first time you are meeting Dr. Ana, she's my superhero.
Oh.
She is a Wonder Woman of sorts who started her journey as a traditional medical doctor. She then found that she wasn't able to provide the kind of care she wanted for her patients. So she actually went back and got trained and is now a naturopathic doctor. So she's my hero because she knows all the things in the world.
All of them.
In terms of how we care for ourselves, health, wellness, well-being. She's my hero. So today we are going to be talking about burnout. Wow. It is a big topic, and we all know how burned out we feel. We all know how burned out the people around us feel. Society is getting burned out. Men, women, and it's probably, I think if we were honest with ourselves, probably going to pass down to our kids also. I've seen so much of it in my own world. Seen so much of it with friends and family, with my team of women licensees. It is everywhere. So I am super excited to talk to Dr. Ana about this topic today. Dr. Ana.
Yes.
Talk to me about burnout. What are you seeing? Why is this so impactful in our world right now? What's happening?
Well, first of all, thank you again for having me and for those kind words. I always never know what to say.
I'm going to send her a badge for my show that says Jennifer's hero.
Yes, and a cake.
Yep.
But yeah, so like on a more somber note, burnout, it's just, I find it's that rat race. I think we've gone so far away from kind of just those essential things in our life, whatever they may be to you. Maybe it's family, maybe it's just having a fruitful career, maybe it's friends, hobbies or passions of yours, and we kind of just want more, or to do more, or the illusion of perfectionism, which is a behavioral trait of those that have burnout. And as a self-proclaimed person pleaser, I've been there at that line of just everything must be perfect. So all tasks are insurmountable, and you never say no, you never create boundaries. And so then depending, right? That's
saying no. Like, I just feel like I want to get my shield up when you say that. Talk about saying no. We all know we need to say no. Everybody says no. We all say yes.
Yeah. And this is, I won't say for the majority, but for a good portion, at least of the patients I see in clinic, and even from, friends and family, if we're just going to take a very crude sampling, when you do get into those discussions of like what's kind of going wrong, and then when you start delving into it, it's usually some form of lack of boundaries. And when we don't have those in place, when we're not firm, or we budge sometimes too easily, and there's always going to be room for that, right? Again, flexibility is key. But when we're putting maybe the needs of others over the needs of yourself, to a detrimental point, right? We're not saying, be selfish, don't be selfish. We're not promoting that. But when it gets to the point where you are overexerting yourself, then that's when you kind of need to rein it back in and start to have more control over the things that you are maybe saying yes to that you might want to say no to. And that's hard.
It's mega hard, because as someone who is, I describe myself to people as a healer. For those of you who maybe don't understand what that kind of means, it's like I'm a fixer. Someone has a problem, I need to help you. I want to help you live your best life. So what can I do to help you live your best life? You have a problem, come talk to me. I'll listen to you. I'll give you advice. I will physically come walk you down the road to get where you need to be. as a healer, that is so draining. And that is exactly what you're talking about, boundaries. And I know I'm the only one out there like that. There is a lot. They're healers. And wow, this is what happened.
And again, I don't necessarily want to label, because I end up using labels, but it's something I try to avoid, especially in society where we can all be very fluid and we might not all identify with a certain persona or stereotype that's been set out. But simply put, like a lot of women, or those that identify as nurturers, and maybe it's not a woman, maybe it's someone who identifies as like male or masculine, but that is a nurturer, a carer, or that is in a caregiver position, like a parent, or maybe taking care of an elderly parent figure. They usually have a tendency, yes, to want to fix, right? I will solve your issues. And even among healthcare professionals, it's one of the reasons I got into the profession. So I'm like, let me fix you. I can fix all your problems
and heal you.
Yes, let me make it better. And because of that notion that that weight that we put on our shoulders, then we don't set boundaries. We don't identify where we cross that line, where this is no longer for me to take on.
Because how can you? Because
right?
You set boundaries and you don't have all of that straight in your head. You're choosing to help some and not choosing to help others. That's what it feels like inside, right? I mean, that's not the reality of what it is.
Yes.
It happens.
Mm-hmm. And then this, burnout is essentially, like when we're talking about burnout, or like its definition, so to speak, right? It's like mental, emotional, physical exhaustion.
Yeah.
So it's kind of...
That's perfect. I want to get into that a little bit, because if there's somebody watching this episode and they're like, yeah, I've heard of burnout. Like, I would say maybe when I was in my 20s, not that I'm that far removed.
Just a couple of years off.
Just like 2 or 3, a little more. When I was in my 20s, I don't know that I would have even known what burnout was. I think it is something that as you get into the mix and the muck of it, you then identify, oh, this is what burnout actually is. It's not what I thought it was. It's not like wearing your hair in a sloppy ponytail.
Yeah, the messy bun.
And it's like wearing your bathrobe all the time. It's none of those things.
No, because that could actually be self-care. Like, I'm just going to put my hair up and I'm going to walk around in my bathrobe and chill. And I'm feeling fine. I am living my best life, right?
That's right. So talk to us really about what burnout looks like, so that people understand, if they've never been burned out or in a period of burnout in their lives. What does burnout look like in a traditional sort of sense? What would somebody be feeling?
Okay, so burnout, again, so if we try to think back up to the 3 states that are really depleted. And I know we said like mental, emotional, and physical, but really spiritual as well. If we're trying to like look at the whole of a person, right? We have like our mental, emotional, spiritual needs, and also our physical needs, right? But in particular, when we're talking about burnout, so when it's gone beyond just that chronic stress, so that might be where we start first. So stress and burnout are different, right? You can be stressed out, but not burned out. But it's a slippery,
still as a stressed out person.
Exactly. But it's a slippery slope, right? As you can see, like it's going to be a gauge. You're going to start out stressed, and then chronic stress, and then all of a sudden you're going to kind of slip into a state of burnout. And so what does that state of burnout look like? So in terms of physical symptoms, most common, and what people will first recognize, is just that sensation of fatigue, right? You're always drained, you're always tired, no matter how much you sleep or how little you sleep, it's all the same. So you'll also maybe have like other physical symptoms like headaches, muscle aches. You'll just feel like blah. Your body won't feel like your body, or like something is off. And that's also in part because of this stress that you've been under progressively that's led to burnout. Your immune system has also kind of been one of the victims, so to speak. So your immunity is lowered. So you'll have more frequent illnesses. So you'll find like, oh, I always have colds. I always have flus. I never seem to get over whatever this is. It's like something's always lingering there. And then even changes in appetite, sleep habits. So you might feel like oversleeping or you can't sleep. You might overeat or you have no appetite. Okay, so that's from like a very physical realm.
Right.
And then emotionally, you'll feel like just low, like there's this loss of motivation. It's almost like apathy. Everything is blunted. So
you know what I picture it being like, having been in it? It's because it's a very visual representation of what I feel, what it feels like when I went through it, is you put me in a mason jar and put the lid on the top. I can see everything happening, but I can't move. There's nothing.
Exactly. So that's a great way to visualize. It's just like there's this vacuum. You're living in this vacuum of like you're seeing everything kind of go by, but there's no reaction, positive or negative. There's just, it's all the same. It's like feeling trapped, defeated, like detached. So detached is a big word, especially if we're talking about parenting, like feeling detached from your children, maybe feeling detached from your spouse or other social relationships. It's just everything's blunted.
Right.
And then in terms of behavioral signs, it's very much what we initially started talking about, when there's those perfectionist tendencies, or you're a little bit more rigid. When you end up feeling burned out, then everything is like frustrating. So you're just taking your frustrations on everyone because you have no patience for it.
Lots of people who are watching just went, yep.
Count me in, right? And then what happens is sometimes then you'll see the consequences of that. You'll isolate yourself. So I know in the midst of this, we're a bit quarantined, so we're self-isolated with those maybe in our household, but even in those relationships, you'll just want to isolate, withdraw from your responsibilities. And then coping mechanisms start creeping up. So not everyone, but some might start relying on like food or alcohol.
Wine.
Yep.
Palm wine, right? The big palm wine. Yep.
And now that's, and now that everyone's kind of at home, everyone's kind of like drinking during the day. It's like day drinking.
Sure it
is. New normal. It's a new normal.
There's memes going around about it right now that this generation of kids is going to be raised by socially isolated alcoholic parents. There's memes about it now. Not funny, but also
kind of true. And that's the thing with like memes. Like I know they are what they are, right? It's very like satire. So it's thinking back to like those comics in newspapers, right? But they kind of point to a truth that we might all be joking about, and it might not quite be like that.
Hashtag funny, not funny.
But the thing is, in some situations that might very well be what's happening. And for whatever reason, it doesn't necessarily mean burnout equals alcoholism or burnout equals like disordered eating patterns. But you will see that in some people across the board. And just, again, it depends on what your relationship has been with those substances in the past. There are many people that are emotional eaters, and they're stuck at home, maybe under extreme stress, and so there might be baking a bit more, or just munching just for.
Or everybody joking about how often they're going to the fridge.
Because it's kind of like that mindless task, right? You just need to occupy your time. So like, I'll go eat, or I'll go make something. So those, in a nutshell, not so nutshell, would be the big.
And what about spiritually? What would we see spiritually?
So in terms of, depending on however you view your spirituality, so maybe that is a connection to God, maybe that is to a source, nature, whatever it is that you identify with as like your core, or that you gravitate to maybe in times of need and times of happiness. Again, there will be just the sense of hopelessness, and this blunted
why
feeling.
Have you forsaken me?
Exactly, like this helpless. No matter what I believe in, whom I pray to, what rituals I partake in, it's all worthless. It won't mean anything. It won't change anything. So again, it just goes back to like a very helpless and hopeless sense. And in talking about this, it does, like, for anyone out there that has experienced depression, or is experiencing depression, or knows of someone, a lot of these things are probably like, oh, that sounds a lot like you're just depressed.
Right.
Right. And that's important to note, because burnout can present as a depression, or at least a lot of the symptoms that we might start checking off might warrant a diagnosis of depression. So it's always important, if you are feeling helpless or hopeless, in particular, if you are having thoughts of like suicide or suicidal ideation, to seek help. And so, if you are someone, if you think they're in immediate danger, call 911.
Right.
Or if you need a mental health specialist, and I know we're all kind of locked in our homes, there is like the Canada's suicide prevention like hotline that you can call. There's even like ways to text or chat that way if you don't want to pick up the phone. So just urge those out there that, it's important to take care of our mental health, and especially if you're experiencing some of these, quite frankly, quite serious, not necessarily side effects, but symptoms.
Yeah. So then I think for me, listening to the things that you've said about burnout looks like, feels like, sounds like, I bet there's a lot of moms that I know who would say, yep, to all of those things. What happens if we don't do something about it? Parents specifically are notorious for, it'll go away, it'll get better when the sun comes out, it'll be better in the summertime, it'll be wintertime when I can get outside and go skiing more, it'll be better when, and then we keep putting it off. What happens if we keep putting it off and we don't address it?
Well, the thing is, burnout kind of like, it seeps into the other areas of your life, right? So one of the very like physical consequences or side effects is much like we talked, right? So like your immunity is going to be impacted, which means, come cold and flu season, you're not going to be as resilient. So just from a standpoint of health and wellness, from a very physical perspective, that's going to be one of the things that might be concerning. So maybe you're not even thinking about your emotional health, but if you're thinking about it, you're just even your physical health of being able to get out there, work, without it being another stressor of having to take days off now because now I'm sick or I'm in bed, right? So you can see it's like a domino effect. But it also kind of seeps into your social life, your work life, how you function and produce, essentially. And because we are talking to the demographic that we're talking about, like parenting, burnout, it's sad to say, but it's a true consequence. Like burnout prevents parents from being like emotionally present with their children. Right. So, and I think I've mentioned this before, and I know, again, it's cliche, but you can't pour from an empty cup, right? So if we're disconnected from ourselves, if we're feeling burnt out and blunted, like you said, like you're in that mason jar, you can't give attachment. Like, how can you nourish someone else if you're completely depleted? Right. It's so we're not going to be able to respond with like patience and model compassion if we're frustrated and empty and hopeless.
How can you ask me for more when I'm already empty?
Yeah. And so it's very much
so many parents that would resonate with that.
It's just like that depleted. I'm depleted. Yeah. And the thing is, like, I know, again, this might even be a meme. It might be one of those infographics that you see around, but it's almost like, again, like your device is on that charging table. Everyone knows to charge their phone. God forbid you're like at a 10%.
Yeah.
Right. It's like, quick, I need to get home. I need to like power this puppy up. Like
emergency.
It is massive emergency, like nuclear calamity.
Yep.
Meanwhile, we're all kind of running around with like that little red light blinking, like I need to be charged.
You have 5% left. 5%.
You're like, no, I can bang this out. I can do more on 5%, right? And that's what you ask of yourself. And the thing is just like, I think it makes sense. And you identify with it. You're like, yeah, that's absurd. But then it's just like, from thinking it's absurd to acting and changing that, it's just like, let's see how.
It's going to be work.
Yeah, that's it. Exactly. It's going to be work.
Yeah.
Don't ask me to do anything else. Like,
Yeah.
isn't
So
there
let's
like a
talk about the
magic
work.
pill?
Yeah, let's talk about the work. What is the work? Because I'm sure burnout is not necessarily a medical diagnosis per se. There's no blue pill for burnout particularly, or maybe is there? What is the treatment? If somebody is listening to this right now and they're identifying, I mean, as we're talking, I'm like, wow, maybe the situation's a little bit worse than I thought it was. I have a little of this actually. What is the treatment? What is the first step?
Well, like burnout is relatively recognized across the board. So like, and you'll see it, especially because it is something that happens so often in families, people multitasking jobs, responsibilities, like healthcare providers, they have quite a high number of burnout in the profession just because of the demands. So in terms of what we do, it really depends on what again, like the individual, what they're presenting with. So it can be anything from stress management and lifestyle counseling to like therapy, cognitive behavioral therapy, to like medication for like moderate to severe depression that isn't responding to maybe some of these lifestyle changes, right? So it will vary depending on what you need and what's going on with you. But in particular, as an ND, what we start with is a lot of the stress management and lifestyle counseling. Okay, so again, it's one of those things.
Your kids.
Exactly.
That's awesome.
That's a non-negotiable.
That's
so
awesome.
Yeah, so it's technically reevaluating your priorities is a good place to start. So just having like a frank conversation with yourself and maybe your healthcare provider that you're seated in front of, like, okay, there's obviously something here that is happening that's gotten you to this point. Mm-hmm. So maybe listing all of those priorities that you placed on yourself or responsibilities that you have and assessing them one by one. So obviously, yeah, you can't get rid of your children and you might not be in a position to quit the job you hate. So then it's a matter of reversing that perspective and thinking, okay, if these are the things I'm set with, is there then something I'm neglecting that's important to me? Mm-hmm. And so that might be, well, before maybe I had children, I used to paint. Or, I used to have that day where I got together with my girlfriends and we used to just chat and rant or what have you. So whatever it is for you, it's like, okay, if that is important, if that is missing from this equation, and we have to think of these things as the things that will recharge you, mm-hmm. then now we have to go into step 2, which is how do we build those back into your schedule? And now you're thinking like,
time.
Time,
Dr. Anna.
Yeah, it's like, did you not hear me? I just said I don't have time for the things I'm already committed to. Yeah.
Right.
But that's but then it's like, that's when I pull out the tough love. It's just like, and this is why you're in the position that you're in, mm-hmm. right? I don't actually say it in those terms.
How's that sleeping until 10 o'clock in the morning working for you?
Right? It's just, it's one of those things that's like, I understand. I know this is asking more of you, but then we need to change, because obviously the way we've been doing things up until now has gotten you to this point, right? Mm-hmm. So it's kind of doing the hard work. It's doing the things that make you squirmy and uncomfortable, the things that like you might ask your child to do, eat your kale salad. And because that's going to be great for their health and for their longevity. Mm-hmm. Sometimes we have to do things that initially don't seem very attractive, right, to start reaping the benefits. And so that's the conversation of, again, it's one of those things that circulate the internet about meditation or something, or yoga. It's like, well, if you think you don't have 20 minutes, that's when you need 40. Right. It's when you've gone to the point where you don't have 10 or 15 minutes of time where you can dedicate to something that brings you joy, that fills your cup, that should be a glaring red sign or like red flag. Something is out of balance. Right. And so it's bringing back balance, right, I think would be that stepping stone of how can I turn this into a more weighted equation. So I'm not just giving everything, but I'm also not just thinking all about myself, right? We have to bring it back into balance. And so if we can eliminate the stressor, then we at least need to pump up the rest of your life with things that bring you joy.
The good things. Yeah.
Mm-hmm. And the thing is, like, sometimes I think we have it in our mind that it has to be something insurmountable. Or like self-care, it has to be something grandiose. Like, I need a spa weekend in Bali.
That self-care word is like nails on a chalkboard to me. It has been so glamorized as getting your fingernails and going to the spa.
Yes.
It drives me crazy. I cannot stand that term.
And this is why when we initially started talking about it, when you're like, oh, you're in that messy bun and walking around with the bathrobe, I'm like, yeah, you're living your best life. Maybe that's you kind of, I'm unwinding, I'm doing me today. Yeah. I need a good half hour to actually drink a hot cup of coffee and like flip, I don't know, through a book that I love or catch up with a friend, right? It doesn't have to be big and Instagram worthy. You don't need to go to Bali.
You can train your family. It's hilarious in my family because for my birthday last year, my kids found, those yellow caution signs, like if the floor somewhere, right? One of those signs. They found one of those for me that said, stop. Something I forget exactly what it says, but something like, stop. Mom hasn't had her coffee yet or something. And so it's put that out in the kitchen. And when my coffee's done, then it goes away. And it's okay, but they get it. And that's it's also, so let's talk about that a little bit too, for families whose parents, mom, dad, whoever it is, might be going through some burnout. Let's talk about the positives in this. And when we go and start doing things for ourselves, like, can we talk a little bit about the mental impact that it has and the benefits that we're teaching our kids? So I don't remember my mom ever doing anything like anything for herself ever. And she was a nurse and also a homemaker. And she didn't start doing things for herself until we were moved out of her home. And then she went crazy for gardening. That's what we now see. But I don't want my kids to be like that. I don't want them to be 50 before they learn. Talk about that a little bit.
Yeah. And so I think there's a shift now as we've opened up the conversation about mental health. It's not so taboo. And I would hope I would be able to say that I think the roles in the household might not be as traditional. Yes, as they once were. So hopefully we're being able to, and this is what I try to do with my patients and friends and family, to really and again, this catchword, to empower, but really to give you back a feeling of it is okay to be your own person and have your own needs and also be a mother or a partner or, I don't know, CEO, whatever it is, right? Yeah. You don't have to say it's one or the other, and you don't have to be self-sacrificial to prove your love or your worthiness of how great of a mom you are or how great of a wife or how great of a leader in whatever career you've chosen. And so when we do show our children that taking care of yourself, so your physical needs, what you put in your body, how much you sleep, how much you exercise, that you love yourself.
It's a gift.
Right? Like, regardless of maybe some shortcomings that you feel you may have or not being able to tick off everything on that list. But at the end of the day, you have compassion for yourself and you're able to forgive yourself for maybe the things you wish you were able to do or the things that you're feeling that you wish you weren't. That's huge. It's like the same way that we model like manners to our children or to be kind to others on the playground. If we can model those behaviors of loving oneself, setting boundaries, teaching them young how to set boundaries in the household.
Like, that just blew my mind. Like, you teach them to say please and thank you. You teach them how to cut with a knife and a fork. You teach them how to load the dishwasher, How is that? Wow.
Yeah. Right. And these things, like, how are they going to learn? Usually in the life of hard knocks, this is how you learn after. If you're not brought up with that, then you're going to learn it the hard way. You're going to learn it when people have walked all over you because you didn't set your boundaries in work or in relationships. You're going to learn it when you're burnt out because you've tried to be everything to everyone other than yourself, right? You're going to learn from a very difficult place. So if we can learn young from someone we trust, like a parent or a caregiver, of how to look after yourself, that's going to be amazing. I often use the analogy in clinic across the board for a lot of things, but for a lot of like the mindfulness perspective and building these things into your life, it's like that marathon, right? So you don't show up to your marathon having no tools, right? So if we think of marathon day as high stress, or like that day when you have 20 things on the go,
all on the line.
It's all on the line. We don't just show up, be like, okay, I'm just going to run this thing.
I'm gonna run today.
I'm not going to stretch. I haven't really been running. I don't know how fast I run a mile. I'm just going to wing it. So if we want to actually excel as well as we can on that day, we need to start doing the work like months ahead of time. So it's the same thing with like stress management. You can't expect to have like this one, miserable day where everything's just going wrong and then being like, oh, maybe I should do those 5 minutes of breathing activity. So it's not going to work. It might help you a little bit that day. I'm not saying don't do it, just give up. But it's not, you're going to come back to me and you're like, it kind of did something, but I'm still feeling out of sorts because you haven't been putting in the work, right? It has to be that conscious effort. You need to set those boundaries, do that mindfulness, eat well, sleep. So that
properly, sleep properly, not with the device, not with the television.
So again, setting boundaries. We have no boundaries. We bring everything into our bedrooms or like our safe space.
Just in case.
Like I understand if you're expecting to hear a call or like there's an emergency, but just make sure it has like blasted on volume and leave it in the other room, right? Or if it's a very, I don't know, particular thing you're expecting to hear back from or a person, then sure. But I mean, every day, like you're falling asleep with like the phone like plastered on your face, right? Again, it's having no boundaries. And what I usually say, it's like a complete disregard for your well-being.
Right.
Like if you saw your child doing that, you'd be like,
are you nuts?
Not today.
Are you nuts? Not happening.
Not happening. Not in my household.
Not now. Not ever. Never.
Right. So it's one of those. If it were somebody else, you'd probably be like, I don't know if that's a good idea, right? So why don't then we follow through with those same things with ourselves? And
because it's the superhero God complex where we all think that we all have superpowers, that we can just handle all the things being put on our
And again, so boundaries with technology in general, and that includes social media. Especially while you're trapped at home, like that useless comparison to what everyone else is doing or how well or not they're doing. It's just like maybe by comparison, like, oh, they look like they're having a hard time, so I don't feel as bad. Or the positives, like, look how great they're doing and how together they have it. I must be terrible
during all of this.
So setting boundaries, telling yourself, okay, I'm going to go on 10 minutes or half an hour, or I'm going to unfollow all those. And
some self-awareness when, what is my body feeling when I see that? Anxiety? Okay, put it away.
Yes, tuning in. Yeah, so that goes into kind of bringing that mindfulness perspective into your life, especially when we're talking burnout and mental health management and prevention. It's being aware of your body. And some diagnoses, yes, that can have the counter effect. Sometimes we try to get out of our body so we're not feeling maybe certain pain. So if we're doing like pain management, we do a different type of mindfulness and wellness so that we're not bringing awareness to those places that ache and are sore. But in this case with burnout, when it's very much cerebral, it's very much in your head, if we can bring back awareness into the now, into the present and into our bodies, it's golden. So one of the things I tell patients, especially if they're like driven by music or they enjoy that, blast your favorite song or two. And especially in your home now, and if you're with the kids, we could all be moving. We all need those, like that serotonin, those endorphins. Put on like 1 or 2 songs. All of a sudden you're 10 minutes out and you've already done like a third of.
You can't breathe.
Yeah, exactly. It is such a way to really shake out all of these anxieties. Like in Qigong, which is a form of like meditation and like movement in nature, one of the steps sometimes you start with is kind of like shaking your body. And you feel very silly and you look very silly, but it's just like whatever your body is asking you to do, just like move. And if you can move that to like an uplifting song, something that gets your blood flowing, then you're already killing 2 birds with 1 stone. You're having a bit of like mindfulness, like an active mindfulness where you're bringing awareness to your body and in the now, but you're also getting in that exercise that you need, because that's going to help you sleep. It's going to help you feel a boost in mood. So if you're dealing with burnout, those are the things you're going to look for. And exercise in particular, you know, it is the antidote against stress and burnout. Yeah. And the thing is, like, you know, there's enough literature on it. It's really 30 minutes of exercise a day can be as effective as medication for depression and mild to moderate depression. So if you can really start building that in, then, you know, it's a great one thing to start doing. If you do nothing else today, start moving, start kind of feeling a little bit freer in your body and allowing your mind that moment of reprieve where you're not caught up in your thoughts.
Right. Okay. So last question. If we were to give people with 2 things, either to think about with burnout or self-assessment tools, what would those 2 things be that we would leave people with on the topic of burnout?
Okay. So the first one, without sounding redundant, boundary setting. So analyze if that for you is a problem. Have you said yes when, if no one would judge you, you would have said no? Or has there been something that you're now resentful of? Because that can be another sign of not respecting your boundaries. So when we agree to do certain things and then like you resent the person for asking you, you know, that's not on them, right? That's on us because we've crossed that boundary and we haven't respected our needs, right? So it's a big one, but it's one that in the long run will prevent you from overextending yourself. So boundary setting, analyzing where you may need to set some of those boundaries and pillars. And then the second thing is, and speaking of pillars, go back to basics. And you'll hear me say this throughout all our interviews, because they really are. The 3 pillars. When in doubt, whole foods, appropriate sleep, and moving your body. It will always make you feel better across the board, no matter what you're dealing with. If we can optimize those things, you're halfway there.
That was beautiful. I am so excited for this interview, guys. I hope you heard some things in here. I hope you felt some things inside of you. I hope that there was a few things that, as Dr. Ana was talking, your stomach kind of went like, whoa, that home. Really I hope things out of there. Dr. Ana, thank you again so much for chatting with us today on burnout. I'm so excited for our next topic, guys. We got another good one, kind of related. We're going to have Dr. Ana back talking in a few weeks about adrenal fatigue. And what that even is.
Or is it something?
Or is it even? Exactly. Perfect. So thank you so much again, Dr. Ana. We'll talk to you again shortly. Thanks, guys. We'll see you next episode of No Mama Grandma. Have a good week.
Bye.